Bismillah ar-Rahman ar-Rahim. Indications of use of non-invasive ventilation. NIV may be used in an attempt to avoid invasive ventilation and its complications, as for example upper airway trauma, ventilator associated pneumonia. Alternatively, non invasive ventilation may represent the ceiling of treatment in patients deemed unsuitable for intubation. Non-invasive ventilator or non-invasive ventilation is not an alternative to invasive ventilation in patients who require this definitive treatment as it is not sufficiently secure. The indications include acute exacerbation, acute exacerbation of chronic obstructive pulmonary disease. Second, acute cardiogenic pulmonary edema. The third indication is decompensated obstructive sleep apnea and obesity hypoventilation syndrome. The fourth indication is respiratory failure from neuromuscular weakness. The fifth indication of NIV is immunocompromised patients who develop acute respiratory failure because they have an extremely high mortality following endotracheal intubation and ventilation and invasive ventilation. The sixth indication of use of NIV is community acquired pneumonia CAP. It's important to say that there is no evidence to support the use of NIV in acute severe asthma, and it should not be used. If ventilation required, then it should be invasive. NIV is commonly used in decompensated hyper, hypercapnic exacerbations of bronchiectasis or cystic fibrosis, and NIV may have a role in improving gas exchange following trauma or surgery, and NIV are being increasingly used to aid weaning after invasive ventilation.